Welcome to the Truth and Fertility podcast. My name is Haley and I am your host. I work at an OBGYN clinic where I teach women and couples how to chart their cycles so they can either achieve or avoid pregnancy and also to manage their fertility. I have a huge passion to teach women and couples about the beauty of their fertility and how the pill is never the answer to women's health. There's a lot of good and not so good information out there about fertility. And so my goal with this podcast is to help you sort out the truth from the weeds. I want to teach you how to chart your cycle and to reach your family planning goals while also maybe even possibly locating hormonal imbalances and to receive proper treatment. I want to help you get in the best hands that you can with the best doctors that you can to reach optimal reproductive health. So if you're ready to get on this journey with me to learn more about your reproductive system, how it was created and how it should be working, and the best medicine in order to make it work if it's not, then you are in the right place. So what is the fertile window? This is something that I'm helping clients look for pretty much every time when a client is charting. We're looking for the fertile window. And when we think of a fertile window, oftentimes we think of couples that are trying to find a fertile window either to achieve pregnancy so they can focus intercourse during this fertile window, or they can avoid intercourse during this fertile window if they're trying to avoid pregnancy, right? So oftentimes we think of it in the context of family planning, but we can also think of it in the context of reproductive health. Every woman of fertile age should have a fertile window. That is a sign that your hormones are balanced in a proper way, in the way that they should be balanced. And so even when I'm working with single women or women that are not wanting to chart for the sake of family planning, but for the sake of reproductive health, I'm looking still to make sure that they have this quote unquote fertile window. So what is this fertile window? So with every single cycle that a woman has, she should be ovulating. And ovulation, for those of you that have not listened to any of my podcasts and don't know what ovulation is the main event of your cycle. It is the most important thing that is happening throughout your whole menstrual cycle. And that is an egg being released from your ovary. This should be happening one time every cycle. And it doesn't matter how long your cycle is. It could be this golden 28-day cycle, or it could be 30, 40, 50 days. It could be 20 days. It could be shorter. But you should still be ovulating one time every cycle. And so when you ovulate, when that egg is released from the ovary, that egg has a 24-hour window of viability, which means it has about 24 hours where if it is fertilized by a sperm, we have a brand new human life, people. That is conception. We have a brand new human life. So we have this fertile window of around the time that a woman is ovulating, because if she's ovulating, that means she's fertile. And if she's fertile, that means if she's having intercourse at that time, that means pregnancy is a possibility. So the reason, though, that we're wanting to look for this fertile window is because it truly is a window. It opens and it closes. And so part of the reason that a woman or a couple might be intending to chart is to find this fertile window, again, for the sake of family planning, but also for the sake of just making sure that her hormones are working as they should, because every woman of fertile age, again, should have a fertile window. So, okay, how do we find this fertile window? How do we know when a woman is ovulating? Well, the first thing that I have any client do when they're learning how to chart is we look at your cervical mucus. And yep, it is mucus, guys. It is all natural. It's coming from your body and it should be there. So we're going to talk about it because it is vital for your fertility. It's vital for your reproductive health, and it's vital for a pregnancy. So in a very regular cycle, right? Let's just think about a 30-day cycle right now. Ovulation is usually going to happen around day 14, 15, just kind of smack in the middle of that cycle. And that's because very regularly, about 2 weeks after ovulation, a woman is going to have her next period, as long as she's not pregnant, right? So with that being said, ovulation happens around the middle of her cycle when she has a 4-week cycle, because there's typically 2 weeks between ovulation and a period, which would mean that there's probably another 2 weeks in between a period and her next ovulation. Now, with an irregular cycle, this becomes a little bit more tricky just because it's not this easy, okay, you're going to ovulate around day 14. We know that's happening. Bam, good, we're done. It's a little bit more complicated than that, but it's not unmanageable. I think there's this idea going around that if you have an irregular cycle, then you can't use a natural system for fertility. You can't chart your cycle. That's not true. That's actually so incredibly far from the truth. And here at Truth and Fertility, I'm interested in giving you the truth about your fertility, right? So with that being said, we're still looking at this cervical fluid or this cervical mucus, right, that your body is producing, because this gives us a really, really good idea of your fertility. Your cervical mucus. So we call it cervical mucus because it is mucus or fluid that's coming from your cervix. Your cervix, you can think about it almost like a canal. So you have your uterus, and you guys can't see my hands. I talk with my hands all the time, but you don't know that. But your uterus is basically, it is your uterus, right? It's about the size of your fist. Then you have the cervix right below that, and it's a canal. And so that means there's a big giant hole in the middle. Then you have your vaginal canal below that. So when I'm talking about cervical mucus, I'm talking about fluid originating from your cervix. So within your cervix, there are these what we call cervical crypts, or these little openings in the inside of your cervix, and that is where that cervical fluid is produced. Now, the hormones, estrogen and progesterone, these are your two main female sex hormones. These hormones orchestrate the type of mucus that you're seeing. So to give you a very, very plain layman's example, when estrogen is high, that typically means that you're seeing a lot of cervical mucus. When estrogen is talking to the cervix to tell the cervix to produce a lot of this stretchy, clear, really slippery or lubricative type mucus, that's a very high, it's very estrogenic mucus. It's high in estrogen. When progesterone is high, this is going to be after ovulation and toward your period. Estrogen is going to be high, and this does the exact opposite. It completely dries everything up. So you're not going to be seeing a whole lot of mucus during that time. So there's this natural ebb and flow of these hormones, estrogen and progesterone, that are ebbing and flowing as they should, as our female human bodies are created to happen. This hormone ebb and flow is what should be happening. This is a very healthy ebb and flow of this estrogen and progesterone, which means you're going to have this ebb and flow of mucus coming and going. And so because this mucus is a direct reflection of your hormones, when you are observing that cervical fluid or mucus and you're charting it, that is why a fertility chart, it's phenomenal for family planning. But if we're only leaving it at that, we're really underutilizing the information that we're getting, because of the fact that with all of these ebbs and flows of hormones that we're seeing based on the cervical mucus patterns, we can see so much more about your hormones, which means this can be used for medicine. It can be used for diagnosis and healing and treatment and so on. So anyways, I kind of went on a tangent with that, but super important to know. Anyhow, with this cervical mucus, the reason that this is really the key player in understanding that fertile window is because sperm love cervical mucus. You probably did not think you were going to hear that phrase today, but let me say it one more time. Sperm love cervical mucus. So something with cervical mucus that we know, especially the mucus that is very high in estrogen, that's being produced around the time of ovulation. This mucus is going to be filled with sugars that the sperm can feed off of. So that's the first thing. The second thing is that if you were to look at this mucus under a microscope, which people have done, which is why I know this information, when you look at this mucus under a microscope, you'll see that there's a lot of teeny tiny little microscopic channels that are within the mucus. You can kind of think of it like an Olympic swimming pool. And it literally opens up channels to allow the sperm to swim through it. So it keeps sperm alive because of the sugars that that are producing, or that are within it, I should say. it's creating these channels to allow the sperm to swim through it. But then also the mucus can help push the sperm upwards towards the egg, because the egg is going to be hanging out in the outer third of your fallopian tube. So if conception were to occur, conception is going to occur in the fallopian tube. And so it's actually the mucus is pushing the sperm upwards towards the fallopian tube to be able to fertilize the egg. So sperm loves cervical mucus. And this is why without cervical mucus, it's virtually impossible for pregnancy to occur. And I've said this before in other episodes, but a lot of the times with the couples that I work with that are struggling with infertility, I'd say a lot of the time, it's because they're just not producing a good amount of cervical mucus. And that's something that, okay, let's move to a doctor who's going to know how to heal that, right? How to focus on that, help you build that cervical mucus and help you get your hormones regulated so that your body is naturally producing that mucus as it should be. Anyways, that's a topic for another time. But the cervical mucus is a direct sign of your hormones, and it's super important for sperm survival. So sperm without cervical mucus will die within hours. So if a woman were to have an active intercourse when she's dry, right? She's not producing any cervical mucus at all. Maybe her estrogen is really, really low and she's not even near ovulation, or maybe her progesterone is super, super high and she's past ovulation. If she's not having any mucus on an active intercourse, typically we would consider that day infertile because of the fact that sperm can only live a couple hours within her body before they die, because there's no cervical mucus there to preserve that sperm. Now, on the flip side, let's say a woman does have intercourse on a day where she's got a lot of cervical mucus. Maybe she's really close to her ovulation, her estrogen's really high, she's producing a lot of that estrogenic, slippery, stretchy, clear mucus. That mucus can preserve the sperm from an active intercourse for up to 5 days. So let's just think about that for a second. Let's put that into perspective. Let's say a woman has intercourse on a Monday and does not have intercourse the rest of the week. She has intercourse on a Monday. She's got a lot of good cervical mucus on that Monday, but she doesn't ovulate until, let's just say, Thursday. Well, what can happen is the sperm from that active intercourse on Monday can be preserved within her body, within her cervical mucus long enough to then fertilize the egg that is released on Thursday. So this is how pregnancy can still occur even if you don't have intercourse on the day of ovulation. Is because of that cervical mucus. If women didn't produce cervical mucus, it would be virtually impossible for pregnancy to occur. I know I already said that, but I'm going to say it again because of how important this is. So when I'm talking about, I promise you, I'm getting back to this idea of a fertile window. So when I'm talking about a fertile window, it's something that opens and closes, right? So if we're staying on this idea of a very typical cycle, your body is going to start producing mucus usually a few days at least before you have that ovulation. And so with that being said, your body is actually giving you kind of like a warning sign, like, hey, you are nearing ovulation right now, which means that whenever a woman is seeing that cervical mucus, she's usually considering herself fertile because of the simple fact that if she were to have intercourse on a day that she's producing a lot of mucus, that mucus can preserve that sperm long enough to hit the egg. So we have this fertile window. The fertile window typically opens when she starts to see cervical mucus. There's usually a buildup of the cervical mucus because of the fact that her estrogen is building up at the same time, and estrogen is typically what produces this mucus, or tells the cervix, I should say, to produce this mucus. Then she'll hit like around what we call a peak, or a peak day. And so this is going to be the last day that she sees really, really slippery, really stretchy, really clear mucus. And then as estrogen drops, that mucus is also going to drop down until she's dry again. And so we typically say that this fertile window opens when she starts to see cervical mucus and then closes when she stops seeing cervical mucus. That's a very baseline understanding of this fertile window. And so the fertile window for most women is going to be around 6 to 7 days, just because of adding on a few days here and there, because of research showing that ovulation can happen a few days before, a few days after peak day, all the things. That's what you learn when you start to learn how to chart with me. You get to know the nitty gritty things like that. But just to give you a very just round numbers example, 6 or 7 days is a typical fertile window for a typical cycling woman. Now, you might be sitting here thinking, okay, well, that's great, but I have cervical mucus all the time. Does that mean I'm fertile all the time? No. The answer to that question is no. No, it is impossible for you to be fertile all the time. So this means that your body is producing more cervical mucus than it needs to be. Now, there's different things that could be going on there. Maybe there's some sort of estrogen imbalance or estrogen dominance in that, in a time of your cycle where estrogen shouldn't be dominant. Maybe there's some sort of cervical inflammation that's causing this excess of fluid. Maybe it's nothing. Maybe your body's just producing more mucus than the typical woman's body does, right? There's not necessarily one size fits all answer there, but I will tell you, I've worked with many women who experience this mucus all the time type situation. And that's when you are for sure going to want to work with me or any instructor who knows how to manage that. Because no, you're not fertile all the time. And I don't want you thinking that you're fertile all the time, because imagine if you're trying to avoid pregnancy and you're seeing mucus all the time. This can be a very frustrating situation for the woman, for the man, for the couple, for the marriage, right? This is not a very it's just not a great situation, right? So that's where my job comes in. That's where I help you understand what mucus is actually fertile, what mucus is actually showing your estrogen rise within your hormone levels, right, within your body, that's pointing toward ovulation. And then what mucus is more of like background noise. Like it's just not helpful. It's not fertile, right? What mucus is fertile? What mucus is background noise? That is what I'm here to help you with. So is it possible? Absolutely yes. I actually have a client in mind right now who never once in my whole time of working with her, which at this point has been like 2 years, has she had a dry day. She has just never had a dry day. But we have, working together, we were able to very, very clearly define her fertile window. It is the same amount of time as a typical woman's fertile window, so about 7 days, give or take here and there for every cycle. And it's completely managed. She knows her body. She knows what mucus is fertile. She knows what mucus is infertile. It's great. It's awesome. This is where I want her to be. She feels confident. I feel confident. We all feel good, right? So is it possible? Absolutely. Yes. It just takes a little bit more time to understand what mucus is fertile, what mucus is infertile. Now, let's say you're also sitting here going, okay, well, I have a 60-day cycle and my mucus just comes and goes whenever it would like. And there's no rhyme or reason to it. It just is here one day, it's gone the next, and then it comes back a few days later. It just goes up and down. Well, if you're sitting here thinking that, then you are actually like me, because I have PCOS, polycystic ovarian syndrome, and this is a very, very common pattern for women who have PCOS, is to have very long and irregular cycles with mucus just coming and going as it pleases. And it can be difficult to understand, okay, what is the true fertile window? Am I even ovulating? Like, what is happening here? Again, that's a reason to work with a trained instructor to understand and help you understand what your true fertile window is. Because even when you have this 60-day length cycle, 100 days, whatever it is, you only have one true fertile window, because if you are ovulating, you're only ovulating once during that fertile window. So working with a trained instructor, I am confident that you will be able to understand when you are truly fertile. Now, when it gets to the point where we're starting to diagnose PCOS or endometriosis or low progesterone or any sort of hormonal imbalances or disorders, that's also a reason to go seek a doctor's help, a doctor who knows how to read your chart and actually interpret your chart and practice medicine based on your chart. don't go to any old doctor, because any old doctor is going to give you the pill. And I have plenty of podcast episodes explaining why that's not the best method of medicine. But so I won't digress on that as much as I want to. But when we get to the point where we're working with, okay, we're starting to see some signs of hormonal imbalance, that's when we're seeking a doctor's help. And so when you're seeing a doctor who knows how to read and interpret your charts and practice medicine based on your charts, your chart with whatever treatment that doctor is ordering for you, your chart should improve. That is the goal, that your chart actually starts to improve, that your hormones start to get balanced correctly, which would make your chart look more normal, right? And that's the end goal. But still, with that being said, no matter what your cycle looks like, you still only have, if you are ovulating, and if you're not ovulating, that's a whole other thing, right? But if you're ovulating, even with irregular cycles, you still only have one fertile window, because you are only ovulating one time. So how do we find that fertile window? You start charting your mucus. You start observing your mucus. You start to understand how to observe your mucus, what different types of mucus look like, all the things, right? And this is what you learn when you start to chart your cycle. Now, one caveat that I do want to mention as well, maybe not a caveat, but just an extra tidbit of information, is that it is actually possible to ovulate 2, maybe even 3 times throughout a cycle. But, huge but here, if you were to ovulate a second or third time, which is definitely more rare for sure. But if that were to happen, it would not happen later than 24 hours of the first ovulation. And so this is where we get things like fraternal twins or triplets, right? Is when you have multiple eggs with multiple sperm fertilizing those eggs, and bam, you have multiple babies. But remembering still that second or third ovulation, if it does happen, it will not happen outside of a 24-hour window of the first ovulation. So it's not like you're going to ovulate again, or you're going to ovulate today and then ovulate again next week. That's just not, it's not how our bodies work. That's just not what's going to happen. Your second or third ovulation, if that were to happen, would only happen within 1 day of the first ovulation. So just wanted to put that out there for those of you that are like, but you can actually ovulate twice because we have fraternal twins to prove that. Yes, totally. 100% absolutely. But that still means that you only have one fertile window, because all of those ovulations, if there is multiple, are going to happen still within that one fertile window. But for most women who are only ovulating 1 time every cycle, that's still only one fertile window. So no matter what here, we're talking about one fertile window. So the best way to learn about this, where your personal fertile window is, and it's going to be different every cycle. Even for the most regular of women, you can still have a fertile window that's maybe 5 days here, 7 days there, 8 days there, right? It's not going to be super consistent. Like, oh, from day 9 to day 17, I am always fertile. Like, that's not necessarily the case. But when you're charting your cycle, when you're learning more about your body, when you're understanding how the cervical fluid can be, or not just can be, is a direct reflection of those hormones, you learn so much more about your body. It becomes empowering to learn these things about your body and the way that it should work. And then when you're charting, we can understand too, obviously your fertile window, as I've been talking about, but we can understand how your hormones are ebbing and flowing. Are they ebbing and flowing the way that they should be, right? In a healthy way? Can we see any signs of hormonal imbalance? These are things we can all see on a chart too, because your hormones, or your mucus is a direct reflection of your hormones. So we're looking for this fertile window, right? For the sake of family planning, again, simply because when a couple is trying to achieve pregnancy, then they focus intercourse during that fertile window. They find that fertile window based on their mucus pattern in order to achieve pregnancy. If they're trying to avoid pregnancy, then they would avoid intercourse during that fertile window, right? Simple as that. It's a behavior change, which isn't always all that simple, but that's another story for another time too. But it's a behavior change, right? In the fertile window for the family planning purposes. But I keep saying this over and over and over again, but it's because this is where my passion lies, in that Your chart it's data, you guys. It is data for understanding your body's mechanisms, your body's hormone balances. We can see so much about your body. I'm sometimes, especially with couples that I'm working with that are engaged and they're wanting to use this in their marriage, there are times when I have seen signs of low progesterone on their chart before they're even married, before they are even wanting to have kids. I can see signs of low progesterone on their chart, get them to a doctor that's going to be able to heal that and possibly prevent a miscarriage from ever happening. Because around 50% of miscarriages happen because of low progesterone. So you guys, charting can be preventative medicine too. It can be preventative. So this fertile window is so incredibly important to find. Yes, for the sake of family planning, but for the sake of making sure that your body is healthy, that you are have a healthy reproductive system, that your fertility is healthy, no matter what state in life that you're in, whether you're wanting to achieve pregnancy, wanting to avoid pregnancy, you're single, you're engaged, whatever reproductive stage that you're in, whatever life circumstance that you're in. It's important to make sure that your reproductive system is healthy, and this is the first way to go about it. So if you're interested in learning how to chart, you can visit truthandfertility.com. You can book an intro session right then and there on my website. The intro session is about an hour and a half presentation, and it will give you more information than you have ever known about your body, about your cycle, about your hormones, and how to chart it. Then follow-up sessions are extremely important as well. You do not know how you are not proficient in charting with just the intro session. Follow-up sessions are super duper important because it allows you time to practice that charting while still being led by me or by an instructor to help fix any mistakes, teach some new information along the way. And especially if you are one of those people that you have cervical mucus all the time, or you have those irregular cycles and it's not just a very simple scenario for you, multiple follow-up sessions are going to be really important. So I can help you, walk you through how to chart, how to find this fertile window, and how to make sure that your hormones are healthy and that you are healthy. So again, that's truthandfertility.com. Thanks so much, you guys, for listening this week, and I will talk to you guys again next week. Thank you for listening to the Truth and Fertility podcast. If you are enjoying this content, it would be amazing if you could leave a 5-star review. That helps me tremendously to be able to continue to produce these episodes for you. Remember that these podcasts are available on Apple, Spotify, and Amazon, and YouTube. And you can always go to my website, truthandfertility.com, to learn more. Thanks again for listening, and I'll talk to you again next week.